I mean, I started training at the height of the AIDS epidemic. So in the late 1980s, when I got out of medical school and I started my internship in New York City, the first time I was on call, I was taking care of 20 AIDS patients. And unfortunately, at that time, there weren't that many great treatments as there are today. And a lot of people were just dying every night. And, so we tried to provide the best care that we could. And I was 24 years old. It was a very frightening experience. And you had to really grow up very quickly because it's a huge transition from being a medical student where you're paying tuition and essentially get a ringside seat versus when you're in residency where you're being paid, not very much, but you're being paid to do the work. And you have to make that quick transition to being a doctor.
Join me, Jeremy Swick, on Into the Unknown, a podcast that delves into the personal journeys, stories, and experiences of individuals across diverse professions. As a historian by trade, I firmly believe that our personal histories shape our present and offer valuable insights into our paths ahead. With that being said, let's get into it. On this episode of Into the Unknown, I am joined with a very special guest, Dean. Dean, how are you doing today?
Very good. Thank you.
I appreciate you taking the time to talk with me today. It's one of those things you never know. Challenges come up right before this. We had to jump in and we couldn't quite get the sound, but we're ready to go. One of the important aspects of networking, I think it's just so important to talk with people and get to know people. How are we connected?
Oh, well, it was through Olivia. She had put us together. We're fellow podcasters.
Absolutely. Olivia does such a great job of not just getting guests together, but also getting the right guests. I love talking with her and who she brings me to share their story. I want to know that comic book issue number one, that origin story. Who are you?
Well, I guess I sometimes I describe myself as I'm a doctor, and I practice in Manhattan, and enjoy my work and my family.
What got you interested in the field that you're in?
I think it was a combination of things that I I like direct patient care. I didn't want to be one of those doctors that's kind of like behind the curtain, like radiologist or anesthesiologist. I like dealing with patients. I also, my specialty in immunology and allergy, I deal with both all ages. I deal with children, young children, and I deal with adults. So it's a nice mixture.
As you mentioned that you kind of specialized in that field of medicine, was it something you set out to do, or was it something you kind of were gravitated towards?
It was a little bit gravitated towards because when you go through training, you're not really sure what kind of doctor you want to be, although you assume, you see on TV what being a doctor is, and that doesn't really give you a lot of direction. But once I was in training, I realized I didn't want to be pigeonholed, as I said, into one category. Like, let's say if you're a gynecologist, you just see women. If you're a radiologist, you just look at X-rays, and CAT scans. I didn't want to be a surgeon. I didn't like the OR. I thought it was very claustrophobic in ways because you kind of sit around and stand around and can't move very much. That wasn't something I liked. So I liked clinical practice, the outpatient setting mainly, and I liked taking care of young people and old and combination. And I guess the other main theme was I've always been fascinated with immunology, like how our own immune system can protect us and if it's made stronger. So that's something that's been a focus of my career. And also, I've also done the last 25 years with my wife. We've been in practice together. We do a lot of holistic medicine. And that's been a nice combination with our conventional practice.
Dean, so when you got started into the medical field, as your undergrad, was going to medical school on your mind right away, or was it something you kind of fell into, looked into, or
No, I was pretty focused. I think you have to be. I mean, some people do fall into medicine, but there's so many requirements and everything. I went to Brown University and I was pretty focused on becoming a doctor. But when I was there, I majored in literature and journalism along with my pre-medical studies because I wanted that. diverse experience.
Now, when you got started, what was that first day on the job, if you will, like?
Frightening. Actually, the first night on call was frightening. When you have a lot, I mean, I started training at the height of the AIDS epidemic. So in the late 1980s, when I got out of medical school and I started my internship in New York City, um, the first time I was on call, I was taking care of 20 AIDS patients, and unfortunately, at that time, there weren't that many great treatments as there are today, and a lot of people were just dying every night. And so we tried to provide the best care that we could. And it was very. I was 24 years old. It was a very frightening experience, and you had to really grow up very quickly because it's a huge transition from being a medical student where you're paying tuition and essentially get a ringside seat versus when you're in residency where you're being paid not very much, but you're being paid to do the work, and you have to make that quick transition to being a doctor.
What kept you going through all that?
I'm sure it's like I was just reading a book out by David Goggins, like Navy SEALs. I think a lot of it is determination, seeing it through, knowing maybe that this is maybe the most difficult but rewarding time in my career and my training, which when I look back, I think it was. But it's what's the term? Like it's like trial by fire. Some people they didn't last, and or they quickly sought areas outside of clinical practice to places where they weren't directly taking care of patients. But having gone through that whole experience, I realized that is what I wanted to do.
I think it's one of those moments you either shy away from it or when you lean into it, you really determine what you're made of, whether it's how long you can endure, but really what you enjoy and what helps you push to that next level.
Right. Yeah. I mean, medical training, I'm sure to this day too, is quite rigorous mentally and physically. And, it takes its toll on people. It leaves its scars, but also there's, tremendous satisfaction. I mean, I love what I do now, and but it took a long time to get there.
What made you start to look into or transition to less of the, I would say, excuse me, I shouldn't say less, but the traditional medicine to more of the holistic approach?
Yeah, I think what struck me was, I guess, one of the things that's so surprising when you go into conventional medical practice. Sometimes how limiting things are. You're there. There were so many conditions and that didn't fit the classical medical textbook of a medical condition. And I was fortunate, I had some early mentors. Some of them weren't even doctors who were enlightening me that there could be ways of naturally treating certain conditions safely and effectively. And I think this is again back in the early 1990s. It got me on the path. And then what I did was, it's really funny. I didn't realize the Mayo Clinic brothers did the same thing, because I once watched this documentary about them, and it's very interesting. There's these two brothers whose father, I think, started a medical practice in Minnesota, I believe. And what they did at the time was, I guess, back in the 1930s or 40s, each brother would take 6 months off and travel to Europe, not on vacation. They used to train with some of the best doctors because that's where some of the most sophisticated medicine was, and then come back, and the other brother would go. And what my wife and I did together, we didn't go separately, we would go to places around the country where there was some of the best training. And one of the people I could think about was in 1994, we went to Dr. Dean Ornish, who was really one of the first doctors who showed you could literally reverse heart disease through diet, meditation, and yoga, which, as a young doctor, that was very eye opening.
What sparked you and your wife to, I would actually, out of curiosity, go into practice together? Was that something you kind of planned out or just
Uh, I don't know. I don't think we really planned out. It just worked out that way. We actually initially were in separate offices, um, doing things a little bit differently. And we had some different staff. And then after a couple of years, we realized, I think we were a little nervous about working together, but we realized it just made sense. We could share resources. We always talked about patients anyway, that we, try to give each other ideas, and it worked out really well. But the funny thing was, is that, as we both know, sometimes we could be in the office the same day, and we don't even see each other till the end of the day when we're leaving. So it's not like you're exactly working together.
You just happen to be the same place
I'm
sometimes.
gonna be in the same place. I mean, if we need each other, we're there. But we're just so busy, doing our thing. So
So you had mentioned you go around looking at different ways people practice and different ideas and concepts. Did you implement that right away in your own practice, or was that something that was built over
no,
time?
it took time. It's funny. I ended up, after training at Dean, well, going to Dean Ornish's special retreat. I came back and I started. Um, I don't know, I guess the term we used, a wellness program at the time, where I would, after work, after a full day of work, I found a yoga studio, and I used to, because I had some yoga training, and I would do like nutritional lectures for patients. So we did things like that. But over the years, it was the same theme, because now I'm doing a lot of things with food allergies and uh, toxic mold exposure. And again, in each of these cases, I didn't just wing it. I sought out the best doctors doing the best work, and did my homework as I do. That's one thing medical school trains you for, to be a good student, to do your homework, do your do your reading, and then go, when you have that opportunity to train with somebody, make the most out of it.
That makes a lot of sense. It's I think so much of it is obviously learning, but
Yeah, I mean, I think the point is, like, what I see sometimes with my colleagues, which I understand because they're so busy and overwhelmed with insurance issues and bureaucracy, that as a doctor in my 30 years of practice, I just never stopped learning. It's why I do my own podcast, The Smartest Doctor in the Room. I get to interview, which I did earlier today, a top kidney doctor, and I learn more about the kidney. So it's like, it's an ongoing education for me. But I just know in medicine, you just can't stop learning. I mean, if you do, you're finished.
I think that's so true, and not just obviously in medicine, but I think in life
A
in
lot
general.
of fields, for sure. Yeah.
And so it's one of those things I always tell people: just keep learning, just keep
Yeah.
learning how to do your job better, or what you like better, or
And it
just
makes it more interesting and exciting, and and then I know my patients, I think, appreciate it.
I'm sure. On everyone's journey, you kind of make a decision, not really knowing the outcome. Can you give me a time you just made a decision and went for it?
Oh yeah, that turns out to be a good question. I could tell you the exact time. It was 1998, and I was doing more allergy in my practice. I was giving allergy injections, and a patient had a really bad reaction, and I went to the hospital with her, from the injection, and she got through it. But it shook me up, because here was a relatively healthy young person coming in for a typical allergy injection, and she had a severe allergic reaction, and it could have gone really bad. And I was rethinking my career at that point, and it was almost like a godsend. I remember this so vividly, because it was the warm weather, like in June. I was on the train, Long Island Railroad, coming back home, and I was just exhausted from that day. And I was flipping through some journals that I had just to buy the time till I got home. And I read this article about a doctor using sublingual drops to treat allergies. And I thought that was fascinating. I said, wow, you don't have to give an injection to do allergy treatment? And this was before really the internet and Google took off. I'm dating myself. So I had to seek him out. So I was fortunate. I was able, through like certain, what they call physician membership things, found out who this doctor was who wrote the article. And I actually reached out and called him and contacted him and said, I read your article. I'm fascinated by it. I had never heard anything like this before. I'd like to come out and train with you to do this. And he said, sure. He was out in Wisconsin, Dr. Morris. May he rest his soul. He was wonderful, real innovator. And I flew out to Wisconsin, and trained there for about a week. Got enough knowledge because I did my background reading and everything, and came back and started doing it in my practice back in New York. And it really transformed my practice, because All of a sudden now, all these people who are coming in for injections every week were no longer doing that, but we were preparing these drops for them to do at home. Um, but it really, over time, catapulted my career. Uh, and I eventually, because I found it so successful, I wrote a book, Dr. Dean Mitchell's Allergy and Asthma Solution, telling about my history. I mean, it was controversial at the time, although the literature backed it up in Europe mainly, and took a lot of heat for it. But it was one of the things I'll never forget that taught me that, because I knew in my heart I felt it was the right thing. I mean, because with the drops, it was much safer, so patients didn't ever get those severe allergic reactions. And that to me was enough to do this. And it ended up making my practice even stronger and better.
Dean, one of those things, it's just you went for it and you took that opportunity. And of course, as you mentioned, there was literature to back what you were doing. It wasn't,
Sure, I wasn't making this up. There's this doctor who was doing it for like decades in obscurity in Wisconsin, and he had a tremendous practice. He had people all over the Midwest coming to see him. And then, he tipped me off to I saw all this literature that was coming out of, really good journals in Europe, very respected places. It was just, there's a lot of forces here in the United States between pharmaceutical companies, insurance companies that were, I think, suppressing it. It's now more common now than it was obviously 20, 25 years ago, but it took quite a while to get there and I didn't want to wait.
oh, that makes a lot of sense. From there, what happened to your career? Did you continue? Did you grow more offices? Did you just continue to work on your craft?
Yeah, I that's a good question. I wasn't the kind of doctor that liked to have like five offices and run a big business. I just wanted to keep on developing my craft, getting better at it. And taking on some new things, that were like adjacent to that. But I think one of the most exciting things I've done now the last like 7 years, because I waited a while to do it, was to use the drops to treat the kids and adults with dangerous food allergies, like the ones that are anaphylactic to peanuts and tree nuts and shrimp. And we've started to do that again based on literature studies that came out of Duke, North Carolina, top places, Stanford, and we've been doing that now in New York as well. And that's really gratifying to see. Just to give you an example, I've been treating a young man who highly allergic to peanuts, and he went on a class trip somewhere to South America. I'm forgetting which country. And while he was there for the week, it was a class trip. There was an accidental ingestion of the peanut, something that he ate. He was hospitalized. He was intubated for a week. And here his mom's up in New York. He's down there. I mean, it was a nightmare. And to do the treatment I'm doing with him now, that's going to give him that extra level of protection, is a huge relief, not only to him, but his mom and dad.
Dean, that's remarkable, and it's one of those things. As modern medicine keeps advancing, there has to be people to help it advance as well. Title of the podcast: Into the Unknown. What are you working on right now? What is your practice got going on currently?
Well, the two biggest things that I'm doing now, which is it's pretty interesting, and again, I sort of stumbled into this a little bit, but it's because I kept my eyes open. I'm dealing a lot with around the country, people exposed to significant toxic mold in their homes, and this manifests with a lot of illnesses. I've had crazy range of symptoms. And again, since it's not really a conventional track where people are trained, I did this extra training with top experts. And so now I'm seeing a lot of people from around the country come in to New York to see me because I have to give them a detox plan to get healthier and better.
That's really interesting. What sparked? You said you had been like, what really sparked you getting into that toxic mold? As you mentioned, it's not more of a traditional.
Yeah, it was for sure accidental because I think it was about 7 years ago. People used to sometimes call my office about that. I thought that was a little crazy, and I didn't know anything about it because I had no training in it. So I used to tell the people who called, we said to them, "No, we don't do that." That was the end of the story. And then I had a patient that was very bright and had some medical issues that I was taking care of her. But she also mentioned to me, she goes, she was very sick with mold. She goes, "There's nobody that does this." She goes, "Dr. Mitchell, you should look into this. We need somebody to do this work." So I thought about it, And then I read an article about a doctor that was like the pioneer in the field in Maryland. And so I reached out to him. He had some training programs that he did. I got a lot of the literature, became knowledgeable in it. But then I moved on to somebody else in California, Dr. Nathan, who's written really terrific books on the subject, trained a lot with him, worked really closely with him. And I guess, like anything, the more you start to take on people and you help them, your reputation grows. And so now I've seen probably over 1,000 of these cases, and I think helped a lot of people, improve their health.
Dean, if people want to learn more about what you do, where can they find you online, on social media? Where are you?
Yeah. Well, our website is it's Mitchell Medical Group, and I think you can find a lot of information if you think there's something there that we can help you with. Um, I also do the podcast, The Smartest Doctor in the Room. But one of the things also that's been so interesting and exciting in medicine these days, which is really unbelievable, is probably about 40 or 50% of my patient load today now, initial or even follow up, is by Zoom. And it obviously makes so much sense because, okay, patients that are out of state I can't treat, but they get to do a educational consultation so they can see, is it worthwhile for them to fly into New York, to get treatment and get on a program. And even sometimes it's funny, people locally in New York, or don't want to get on a train or whatever, or if they don't feel well, we can get a lot done. I mean, because I'm not doing interventional surgical procedures. I'm trying to evaluate you and decide what's the right protocol for you. So this was something I never dreamed of myself either, but I've embraced it and I think utilized it to help a lot of patients.
That's fascinating. So, was that something that kind of took off during the
Well, I
pandemic?
think, yeah, that it took off. I started to do it a little bit, probably in 2017 or 18, I think, but it really took off during COVID. I mean, that really was a game changer. And when people realized, this thing called Zoom or whatever, one that you use, um, can be a valuable tool in evaluating patients.
Well, Dr. Dean Mitchell, I want to thank you so much for being patient and taking time to talk with me today. I truly appreciated our conversation.
Yeah, and I've enjoyed it a lot too, Jeremy. Thanks for having me on.
We'll talk soon.
All right, take care.
That was another fun episode of Into the Unknown. I truly appreciate you taking the time to listen. And if it provides you any value or entertainment, I would love if you shared it with others, liked, subscribed, and really just help the podcast grow. Again, tell a friend, tell a foe, just anyone who might enjoy hearing some stories of people's own journeys and what got them to where they are today. Till next time.